Good morning, guys. My name is Neal Kleiman. I'm director of the cath lab here. Some of you know me as the host of whatever that was last night. That's not what I do full time. So first of all, I would like to express my thanks to Dr. Lumsden, director of the Heart and Vascular Center. And the reason I want to thank him is I started to give this talk next door and he patted me on the shoulder and said, "You're in the wrong room." So with that as background, I hear through confidential sources that there are seats up front. Please move up, don't sit in the back. So I'm supposed to spend 15 minutes talking to you about thrombosis and antithrombosis. So first, I got to figure out who I'm talking to. So are we all cardiologists? Is anyone here a surgeon? Radiologist? Anesthesiologist? Okay, good. So, Razvan, imagine for a moment that you're God. Hard to do, but really stretch things. So, it's the day before, it's day 0. Creation hasn't happened yet. And you have to design a bunch of animals. So how are you going to design them? What are the things that are going to run through your celestial mind? Design an animal real fast.
Like the first animal?
The very first animal.
So maybe it has to have some survival mechanism?
Yeah, good.
Defense against nature?
Okay, so defense against the other things you're going to create. And that's really good. So how are you going to do that? So if you're thinking about this, you got to figure out that cells need nutrition. You got to have a system to deliver nutrition to them, take away waste. That's what circulation does, right? So now you got this vital fluid. Now what are you going to think about?
How to deliver it?
How to deliver it. Okay, but I'm not a heart failure guy.
Well, but you still need the pump.
We'll leave the pump out of it. You got to figure out how to conserve it, right? I mean, so you're going to create this animal. You got this stuff that delivers food, takes away waste, and you don't want the stuff to leak out. And you don't want the stuff to gel up either, right? It's sort of like owning a car in a northerly climate. You got to have the fuel flowing. You got to have mechanisms so you don't lose the fuel, and you don't want the fuel to freeze on you. So that's what the coagulation system is all about. You know that. So it's all about balance, and that's what one of the things you're going to spend the rest of your lives doing is figuring out how does this stuff balance. So we're going to shift from being God to being a 911 dispatcher. So Roz, the heat's still on. So you're a 911 dispatcher. A huge building full of people has caught fire. Who are you going to send there first?
The firefighters.
Who?
Firefighters and...
Wrong. Because if the firefighters get there, what are they going to do? They're going to trip over each other's hoses. So who else? Who do you want to get there before the firefighters?
ambulance, I guess.
Even before the ambulance. I mean, you know, the building's on fire, the ambulance guys aren't going to run in there. Okay, well, you're going to send the fire chief, right? And what does he do? The fire chief. He's the guy who drives around in an SUV, gets there first, and what does he do? He doesn't put out the fire, he doesn't run into the building. He brings in everyone else and tells them what to do. That's what the platelet does. So your burning building is an injured blood vessel, and your first responder is the platelet. So when I went to medical school, I was taught, well, platelets have a special role. You know, they form a layer, and that stops the bleeding, and life's taken care of then, right? But, you know, anytime you've injured a blood vessel, which we all do for a living, you learn that it takes a lot more than a single layer of platelets to achieve hemostasis. So the way I want you to spend the rest of your career thinking about platelets is this. They are first responders. They are cells. And like every other cell in the body that I know of, they do multiple things that are really complex. So a few things you need to know about platelets, and you probably do. Platelets are little plates. That's where the word comes from. They circulate. They look like little discs. They're produced by megakaryocytes. So if you trace back the lineage, you get to these pluripotent stem cells that eventually become hematopoietic stem cells that eventually become megakaryocytes. Megakaryocytes are big suckers. If you've ever seen them, if you've ever seen these videos of how platelets are born, you got these huge cells in the marrow. They form pseudopods. The pseudopods break apart. As that's happening, nuclear material gets moved from the edge of the megakaryocyte toward the center. The platelets, megakaryocytes are multiploid. They've got multiple copies of the genome in them. As platelets break off, the nucleus is gone, the DNA is gone. What remains? Well, lots of proteins. Proteins are sequestered in granules. And what else remains? Something we haven't recognized until the last few years. RNA. Messenger RNA and pre-messenger RNA. And in the last few years, we've learned that when platelets circulate and you activate platelets vigorously, with thrombin, for example, messenger RNA or pre-mRNA is spliced, processed, and even though the cells are anucleate, they produce proteins in response to stimulation, something we'd never conceived of before. So these cells are really active, and they direct the thrombosis process. So how does that happen? Well, a blood vessel is injured. Things that are supposed to be hidden from the circulation, that's the way things are designed. You don't want your prothrombotic stuff sitting on the internal surface of a blood vessel, otherwise they clot and blood doesn't flow. These things are exposed. And so platelets attach in a two-stage process. So the first stage has to be rapid. That's what rapid responders do. That's why fire chiefs drive these little SUVs with multi-cylinder engines. I mean, those vehicles are fast. You don't want to race these guys. So the rapid response is the first step. And that occurs through glycoprotein 1b and its interaction with, anyone? Okay, good. And how does that happen? What mediates that? Von Willebrand factor. So endothelial cells produce ultra high molecular weight VWF stored in the Weibel-Palade bodies. And then when the endothelial cell is damaged, this stuff's released. And if you look at this with ultramicroscopy, these molecules are large. They're really long. And glycoprotein 1b is really long. So you got these long tethers sort of flopping in the breeze, and this grabs cells and pulls them down. The downside of that, well, the upside is it's really fast. The downside is it's really weak. If you blast some blood past an injured surface that's only expressing VWF and it's only captured by glycoprotein 1b, the platelet will sort of touch down and blow right off. So there's a second stage. The second stage occurs more slowly, but the bonds are firmer. And that second stage is mediated by, no. The second stage is mediated by integrins, glycoprotein 2b3a, and an immunoglobulin, glycoprotein 6. So GP6 binds to collagen and clusters on the cell surface. 2b3a binds to Well, it binds to several things. You all want to say fibrinogen, I know that. That's not the right answer yet. At an initial site of injury, 2B3A binds to VWF. That's the way it works. High shear, 2B3A sticks to VWF, holds the platelet in place. During this time, the platelet's being activated by things like ADP. Other mediators cause platelet shape change, activation. All these other active molecules come to the surface of the platelet. And that's the very first stage of thrombosis. And you really have to know that, because everything else that happens and everything that we do to intervene on thrombosis occurs from that point forward. We don't really have anything in our armamentarium now that interferes with that first step in formation of a clot. And if you take a clot and section it, you'll find that the composition of the clot varies as you get farther and farther from the injured surface. So if you look right against the injured surface, it's all platelets. And if you stain them, it's all platelets and VWF. As you get further out, the biology changes. And now it's platelets adhering to other platelets, so-called aggregation, through 2B3A binding now to fibrinogen, as well as VWF, as you get further out from the surface. But remember, the platelets are now activated. They undergo shape change, and what happens then? The platelet membrane flip-flops, and phosphatidylserine, which was previously expressed on the internal surface of the platelet, is now expressed on the external surface. And what does that do? That allows the soluble coagulation system to become activated. So that's the second point at which we as physicians intervene. So once that happens, then you can start assembling these large macromolecular complexes of coagulation proteins that we spend much of our day trying to interfere with on the surface of an activated platelet. And that's how the thrombosis cascade becomes accelerated. So if you think about that part, you've got an activated platelet surface. It now attracts calcium because of the charge. And now you get several different macromolecular prothrombotic complexes that form on the surface. So you get the 10-ACE complex, which allows the formation of activated factor 10A. And activated 10A does what? Activated 10A now allows you to activate thrombin. So there's a cascading effect. First you activate the very basic coagulation proteins, factor 7, then tissue factor, then factor 10A, then factor 2A. And each time you go downstream, each one of those complexes activates multiple copies of the other complexes. And the number to remember is 150. Why? Because it's a nice round number. It's approximately correct. Every 10A molecule that's activated activates 150 molecules of thrombin. Thrombin does what? Thrombin feeds back in a positive manner and activates the coagulation cascade further. So if you look at this, this is really an avalanche. Follow an avalanche, it starts with a little snowball or a little slab release up top. As you head down a snowy slope, the avalanche moves faster and faster, and stuff sort of flows into the middle until it catches the guy who's skiing and buries him. This is no different. And remember, it's also a world of smoke and mirrors. There are balances built in. That's when Razvan, who was very intelligently designing an animal, said, okay, we got to have a way to turn this off as well as turning it on. So that's where the the factor S and factor C come in. These interfere with the soluble coagulation cascade. They feed back fairly early in the chain. they're activated by thrombin. So every time you're turning something on, you're turning it off as well. And the various things that we do as physicians intervening in this cascade, the various drugs we use that, see, I'm already 15 minutes over and I'm not going to be able to talk about, interfere with various levels of that. So rather than, you've noticed I haven't used any slides. I don't want to put up a list of things that you're supposed to memorize and won't. We have a cure for that disease. What's that cure? Come on. Most important thing in your white coat pocket. Yeah, so it's not snacks. It's not a pen. It's not chapstick. It's this. So, you know, if I can tell you anything, memorize what you have to memorize. Don't spend your life memorizing these damn things. I didn't put up slides because I don't want to have a list of the 2B3A antagonists. I don't want to have a list of the P2Y12 antagonists. I did have one slide of the NOACs. And why do you think I had that slide? Why do you think that was my only slide that I didn't get to? What's that? Yeah, and I can never remember it. So I figured if I got to that, rather than saying this one is, I got all four of them up there. The percent absorption, percent renal excretion, percent hepatic excretion. I can't remember that. Every time I prescribe a NOAC, what do? I say to my nurse, pull this thing up. We're going to start the patient on it. Let's see how much we start. Let's see what we have to correct for. Let's see if this patient has contraindications. Don't pretend you've memorized everything, because, you know, part of learning is forgetting. That part becomes a lot easier as you get older. Look this shit up. If you don't, you're committing malpractice. Okay, I guess I'm out of time.